Mood Disorder by Ramneet and Karn for Psychology 1200. What is mood disorder? Mood disorder are extended periods of depressed, euphoric, or irritable moods that in combination with other symptoms cause distress to a person in their daily life. There are two types of mood disorder we will be talking about today. First one is depression and second one is bipolar disorder. Depression is a mental illness that affects a person's mood. Mood impacts the way people think about themselves, relate to others, and interact with the world around them. An acronym to remember depression symptoms is known as SICAPS. S stands for sleep, I stands for interest, G stands for guilt, E stands for energy, C stands for concentration, A stands for appetite changes, P stands for psychomotor agitation, which is a type of restlessness, and S stands for suicidal ideation. In order to diagnose a person, at least 5 of these symptoms must be present for more than 2 weeks. There are 2 types of depression. Typical depression is where there's a decrease in all the symptoms but increase in guilt, and then there is atypical depression where there's increase in weight, sleep, and also guilt. Bipolar disorder is another mental illness that affects mood. With bipolar disorder, people experience episodes of depression and episodes of mania. An acronym to remember bipolar disorder symptoms is known as DIGFAST. D stands for distractibility, I stands for insomnia, which is not being able to sleep, G stands for grandiosity, which is an unrealistic sense of superiority, F stands for flight of ideas, A stands for agitated, S stands for sexual indiscretion, and T stands for talkative or pressured speech. In order to diagnose a person, at least 3 or more of these symptoms must be present. If these symptoms are present for more than 1 week, that is considered as bipolar 1, also known as manic. And if these symptoms are present for less than a week but more than 4 days and show major depressive episodes, it is considered as bipolar 2, also known as hypomanic. Who is affected by mood disorder? Depression and bipolar disorder can affect anyone. They are likely caused by many different factors that work together, including family history, biology, the environment, life experiences, personality, and physical health problems. Mood disorder can be very challenging. Usually people blame themselves and wonder why they can't get over it. Others worry about what people will think if they ask for help. Depression and bipolar disorder are real illnesses that require help. Antidepressants are medication used to treat depression. There are a variety of class and antidepressants that work together. But antidepressants do not work for bipolar disorder. Instead, mood stabilizers are used to treat bipolar disorder. But this does not stop the thinking pattern that start mood problems, so people incorporate medication with cognitive behavioral therapy. This type of therapy teaches you skills like solving problems, realistic thinking, relaxation, and managing stress. If all else fails, another form of therapy known as electroconvulsive therapy is used. This is where small electric currents are passed through the brain, intentionally triggering a brief seizure. This causes changes in the brain chemistry that can reverse symptoms of depression and bipolar disorder. Both depression and bipolar disorder can make people feel isolated from others, which adds on to mood problems. Joining support groups creates a safe environment to share experiences, learn from others, and connect with people who understand what you are going through. Regular exercises can boost your mood as well with help manage stress. Eating well and maintaining healthy sleep habits are helpful. Spending time on activities you enjoy or finding relaxation strategies that work, and spending time with loved ones can help as well. How can you help a loved one? When someone you love is diagnosed with depression or bipolar disorder, you may wonder how you can really help. You can offer support in different ways. You can offer emotional support or practical support to help make the journey less daunting. You can also learn more about the illness and listen to your loved ones so you can have a better understanding. You can ask your loved ones how you can help them. But make sure your expectations are realistic. Recovery takes time and effort. You should make your own boundaries and talk about behavior you aren't willing to deal with. And if family members are affected by a loved one's illness, consider family counseling. If you have any additional questions about depression and bipolar disorder, you can contact Canadian Mental Health Association to learn more about support and resources in your area.